Hi, Assalamu alaikum. I'm a Dr. Baik in Korea. I'm a breast surgeon. Today, I told you about breast cancer. Okay, this is my title, Current Status of Asian Breast Cancer. I mean, in Korea, perhaps Arab is UAE also almost the same. And I'll give you a new technology of the oncoplastic surgery. Oncoplastic means the beautiful surgery for the breast cancer. First of all, I will tell you about breast cancer risk factors. Obesity, this obese, high weight gain makes a risk factor. And no exercise, that means low physical activity is a risk factor. No breastfeeding. Breastfeeding period is longer than breast cancer incidence decreased. Alcohol abuse is one of factor, and the hormonal replacement therapy. This means after menopause of the woman, they sometimes takes a hormonal medicine, but this hormone makes a high risk. And the birth control pills. Before the 25, if someone takes much more, the oral pill is a risk factor for breast cancer. And most important thing is not having children. That means the more the pregnancy, the less breast cancer. And the high fat, high calorie diet can be a risk factor for breast cancer. This slide shows depends on the consumption of high fat, high calorie diet, the breast cancer increase. That means the OECD countries makes a higher incidence of the breast cancer. That means the underdeveloped country has a low breast cancer incidence, and the higher the income country, I mean OECD country, makes a higher incidence of breast cancer. If you get the high fat, high calorie diet, then you becomes heavyweight. That means, but two types of the body figure. This, even if the same the weight, body weight, this means this we call the apple shape. This shape is a pear shape. That means this apple shape has a upper part is more heavier, but pear type is lower part is more heavier. But this type of body figure is no increased breast cancer. But this, I mean, apple type has a high incidence of breast cancer and heart disease and also diabetes mellitus. So depends on the body figure, we can guess what kind of disease will be a disease. What kind of disease will you get? Well, this is actually the Korean breast cancer incidence. Korea actually recently is one of OECD country becomes, but in the past we are very poor. But recently we became an OECD country, so this means the total breast cancer incidence rapidly increasing, annually 6.1%. And this yellow curve is DCIS, I mean stage 0 breast cancer. This means stage 0 breast cancer increasing means early detection, where in Korea, government gave us a favor for some check up their health, especially over 40. Every 2 years, the government check the woman's health without pay. That is very important. So early detection we can easily. This is where Korean, in the past, about just 20 years ago, breast cancer is very relatively low incidence, but recently about 4 times increase. Where this is chronological trend, the age distribution pattern. Perhaps you can see that this is, we follow many years, every 2 years check up the what age group will be a peak for the breast cancer. For example, this is where 2000, 2002, 4 like this, but the breast cancer peak incidence is almost the same. This age is late 40s and early 50s. But this pattern is a little bit different from the Caucasian, where this is Caucasian, American, American is depends on the age, more incidence, higher incidence. The orange color is Korean, the blue color is Japanese. That means, well, anyway, Japan is a little bit higher economic status than that of Korea. Anyway, Korea, at least Japanese follow the American, and the Korean follows Japan, and also at just in future will follow the American. That means almost the same phenomena. That means now, until now, the Korean breast cancer peak age group is late 40s and early 50s. But for example, 30 years later, they're almost the same, the pattern. Well, this is you can see the 40s, the most common age group, followed by 50s, followed by 60s, and then 30s. This is a little bit different from that American, Caucasian. Where this is a histogram. In the past in Korea, the blue one is premenopausal patient. Married is postmenopausal woman. That means in the past, in Korea, premenopausal woman cancer is higher than the postmenopausal woman. But recently, a little bit changed. The postmenopausal woman is breast cancer incidence is higher than the premenopausal woman. This is a Caucasian style. That means the disease and culture, any kind of the social phenomena follows the developed country, OECD country. So we can also be almost the same phenomena. Thanks to the early detection, we have the most common stage group. Stage 1 is most common, followed by stage 2, and then stage 0, and then stage 3. When I was a young doctor, when I was the residentship, in Korea, almost all breast cancer is stage 3 and 4. But already I told you, thanks to the government strategy, and we have early detection chance. So like this, stage 1 is most common, followed by stage 2, followed by stage 0. So recently, we cannot find out the stage 4. Well, this is a histogram. This blue one is a stage 0. This one stage 1, stage 2. already I told you stage 1 is most common, followed by stage 2, and the stage 0. Recently, the surgical pattern is quite changed. Perhaps as you know, in 1984, Dr. Halstead in America, he succeeded the breast cancer treatment with operation. At that time, he removed the total breasts. That means radical mastectomy. But recently, in Korea, most common surgical type is breast conserving surgery, and followed by mastectomy. This breast conserving surgery has many good effects. When I was a young residentship, at that time, almost all breast cancer underwent a mastectomy. That means totally removed breast. Then the patients and distressed, disappointed their figure, and they addressed sometimes the patients commit suicide, and some patients and make a divorce, sometimes quit the job and go to the mountain. But recently, after this vicious breast conserving surgery, and almost nobody, like they, for example, commit suicide, no. They quit the job, no. Don't go to the mountain. Well, this is a pattern, a surgical pattern. Yellow one, the pink one is actually the in the past lower than the mastectomy, but recently increasing. That means already I told you breast conserving surgery. I started breast conserving surgery in 1986 here. Now, the mastectomy and the breast conserving surgery cross over at 2006. That means when I started in 1986, the breast conserving surgery in Korea, in Asia, nobody believed that breast conserving surgery will not safe. But recently, they agreed and increasing the breast conserving surgery. Almost the 67%, recently 70%. In our hospital, about 75% breast cancer underwent breast conserving surgery. That means the breast cancer patient's quality of life is much improved. That means in terms of the cosmetic effect, but also the psychological effect. Well, this is the Caucasian and the Asian almost the same. The most common histologic type is invasive ductal carcinoma. And ductal carcinoma inside means stage 0. And rarely the lobular carcinoma inside, and the very, very rare malignant phyllodes tumor, Paget disease. This is very, very low. So breast cancer has characteristic biological markers, where if the patient bear the victim of the cancer, then usually the surgery and the chemotherapy, radiation therapy, immunotherapy, and so on. But one of the very characteristic factor in breast cancer is a hormone-dependent case is almost 75%. The estrogen receptor positive, progesterone receptor positive. If the receptor positive, we can treat the breast cancer patient with hormonal therapy. And the CRB2 is one of the factor of the target therapy. If this CRB2 positive, then breast cancer prognosis is not so good in the past. Perhaps in the past, the worst pattern. But recently, we have a specific agent, target therapy agent, the Herceptin. Herceptin, we have recently treated the patient in case of the cell positive. If we classify the three kinds, weak, and intermediate and strong positive. In this case, we treated Herceptin. Then the prognosis becomes a very good result. And also, another very important biologic marker is KI67. This means actually this hormonal receptor, this is a target therapy, but this is the proportion of the tumor growth fraction. If higher the growth fraction, then bad prognosis. If lower the growth fraction, that means a good result, good prognosis. So depends on this KI67, we treat the patient with depends on this KI60 level. So many factors for the after surgery, hormone positivity, cell positivity, and the KI60 percentage. So-called the precision medicine. Precision medicine also include the genetic factor also. We have if there is an abnormal gene, we can remove the bad genes with CRISPR-19. Perhaps you know, this year, the Nobel Prize Award is a CRISPR-19, so means there's abnormal gene seizures. So two doctors have a Nobel Award laureate. Well, recently anyway, like this, breast cancer mortality is decreasing. Incidence is increasing, but mortality rate is decreasing due to the first of all, most important thing is earlier detection with mammography, sonography, or gamma specific camera or MRI. And also the surgical technique improvement, hormonal therapy improvement, chemotherapy improvement. Perhaps you know, chemotherapy. With chemotherapy, you lose hair, and some abdominal pain, and the white blood cell decreasing, and fever like this. But anyway, with total treatment modality, we combined, and we treat the patient the personal treatment. So effective is higher, side effective is decreasing. And after surgery and the chemotherapy or during the treatment, it's better to take a complementary therapy. The most important, one of the important complement therapy is diet. Diet is most important, especially for breast cancer treatment. Well, in Korea, I'm very proud of Korean Breast Cancer Society activity because in Korea, the 5-year survival of the breast cancer actually more than 90%, more than. And the 10-year survival almost the 85%. This treatment results is almost top of the world. So many American, European, and Asian countries visit Korea in our hospital. also. The Korean breast cancer characteristics and the good news. Already I told you, stage 1 to 0 is higher. And also with this early detection, the proportion of the breast conserving surgery is higher. And recently, I do also many Korean breast surgeon immediate reconstruction after mastectomy. That means simultaneously we do the breast cancer removal and also cosmetic surgery also. So the woman cancer, breast cancer quality of life much improved. And I already told you, good overall survival rate in most stages, 5 years, 10 years survival. Already I told you more than 90%, almost 85% respectively. But bad news, the annual increase in the number of breast cancer patients, about 6.1%. Actually, Caucasian in America, anyway, the most common woman cancer is breast, and they already very high, about 3 times than that of Korean breast cancer incidence. But increasing rate, about less than 2% annual increase. But Korea belong to the OECD country, but still developing in terms of economic status, so still rapidly increasing. But someday almost the same as that of the American. And this is one of better news. It's higher proportion of the young age group. I mean less than 40s. This is actually the 3 times higher than that of American young woman. I mean, total breast cancer incidence is higher in America, but young age group is higher in Korea. Because not only Korea, Asian breasts is relatively small and compact breast tissue, that very thick parenchyma breast. So if you check the mammography, then the relatively the great white color. But in American or Caucasian, it's very big breast, but with a mammography, we can find out the breast cancer commonly. But Korean, Asian is small and dense, so we cannot easily find out breast cancer. So we check the breast with sonography also. So 2 kinds is necessary. Your country also, of course, it looks like we are Caucasian, but anyway, breast sonography and the mammography is necessary. Actually, it's my personal opinion from the Arabic woman visited me. I mean, in Ewha Womens University Cancer Center, I do myself more than 250 patients treat the breast cancer from your country and some near your country Arabic woman. As a conclusion, this is the current status of Korean breast cancer, but this is Asian, same, and your country also. Annual increase 6.1%. So anyway, the most common woman cancer all over the world is the breast cancer, the most common. Underdeveloped countries, the most common most common woman's cancer is uterine cervical cancer. But overall, including OECD country, the most common woman cancer is breast cancer. perhaps you know, we have two kinds of cancer. One is like breast cancer is a solid mass. Another one is leukemia, very circulating cancer cell. But anyway, if the tumor solid, breast and colorectal, liver, anyway, surgery is most important. But breast cancer is removal of the cancer is also important, but because the victim is a woman, so we have to consider the beauty, the cosmetic effect, also psychological effect. But historically, already I told you, 1894, the Dr. Halsted in the Johns Hopkins succeeded breast cancer treatment with this radical mastectomy. This means remove breasts and remove under the breast is the pectoralis major minor and also axillary dissection also. But thereafter, after the modified radical mastectomy is most popular. This radical mastectomy prevailed about 70 years. But after chemotherapeutic agent, modified radical mastectomy is much popular. But recently, the breast conserving surgery is popular. Actually, the pioneer of the breast conserving surgery is Dr. Veronese. He worked at Idri Cancer Center Hospital. He reported this result at the New England Journal of Medicine, and then I visit his hospital and I learned his technique. At that time, I thought his concept is right. So I started the breast conserving surgery in 1986. At that time, my teacher, my colleague, they brand of me, because at that time it's a modified radical mastectomy is more popular. But I think at that time, I believe that breast conserving surgery is almost same in terms of the recurrence or survival. So I continued. So already I told you, in about 20 years later, the Korean breast surgeons follow me. At first, many the doctors, even my teacher, blame of me, but I continued this technique. So now, anyway, this breast conserving surgery, not only in Korea, but also all over the world, is they accept it. It's much improved. Thereafter, this is radical mastectomy, modified radical mastectomy, breast conserving surgery, much improved surgical technique, but recently also oncoplastic surgery, more improved, more beautiful to prevent the commit suicide and so on. So so-called oncoplastic surgery conception was by the Dr. Odrich, the German doctor. I met him, and recently, already I told you, the simultaneous reconstruction of the breast. And this is also another technique of to prevent operation complication, sentinel node biopsy. This is several kinds. One is at first blue dye technique, and also red isotope technique, recently IC technique. I follow. I like red isotope technique. This is the famous Giuliano and Dr. Craig. So, anyway, the result of breast cancer treatment is very high. So, not only tumor removal, but also have to cosmetic effect also, because the victim is a woman. So, not only cosmetic effect, but also psychological effect. Is cosmetic effect very, very important. If the rate of local country is the same, then beautiful appearance is so very important. Like this, Dr. Harshad, 1894, like this, totally remove breast. And also under the breast, pectoris major minor muscle removed. And X-ray dissection was already done. With this is arm edema, and the function is not good. Range of motion is limited. So, and sometimes tilting the body figure with this normal breast side tilting. So thereafter, and this is modified radical mastectomy. And then much improved. With this, and we treat the patient with hormonal therapy or the chemotherapy or radiation therapy or the many kinds immunotherapy also. Much better. If you some make some pseudo breast insert into the bridge, then almost the same. This is actually Veronese, 1981. He started. I followed him 1986. At that time, American breast surgeon didn't follow like this treatment, but much more a good effect in terms of cosmetic, also psychological effect. So like this, if wear the bridge, then almost the same. This line is radiation area. It's a Giuliano sentinel node. Dr. Veronese, he started breast conserving surgery, but routinely X-ray dissection. But recently, just we find out the sentinel node only with a very small incision. Then arm edema or some numbness, it is much improved. So I gave a lecture many countries about new technology of oncoplastic surgery for breast cancer, not only in Korea, not only in Asian, go to the also the Arab new country I visited also, and Europe, Hungary, and America, and Canada, Norway, and London. I gave a lecture about new technology of oncoplastic surgery. This is isotope proof. With this, we can find out only possible positive lymph node. We can find that very easily. It's a very good facilities. It's small, but very expensive, about 40,000 US dollar. And then with the pick up the lymph node, and then the sample lymph node they sent to the pathologic division, and wait the result. And this is the main lesion. If this cavity is very high, incision is small, but under remove the area high, then after suture here, the sunken, so prevent. In the past, I used like this mesh and covered interseed. Then like this, insert this one, and the suture depends on the node positivity and suture, then looks so good. In 3 or years, anyway, 2 or 3 years, looks disappear this scar also. But recently, much more developed one. This is actually the acellular dermal matrix. This is from the course, I mean, dead persons. This material from the dead person's dummies, but removed cells, the dead person's cell removed, and then with this, that means no allergic, no foreign body reaction. So remove the tumor and insert this one. Remove the tumor, I clipped here and the medial lateral lower high superior, and then insert the suture to the parenchyma, and then this is actually lymph node. I mean the sentinel node removed area, and then suture like this. Then almost the scar is very beautiful. Recently, so even this relatively large tumors, and after remove the lymph node, we can use this, for example, new pattern, new figure of the ADM palette. Previous one is just like a sheet, but this is pellets. So easily insert this pellet into the cavity, easily molding, shape molding, then much more beautiful, like almost the same curve. This actually. So even small near the nipple, and then this cavity also curved. With this palette is filled. Like this one is almost looks like a benign surgery, much more beautiful. So that means the recently to remove the tumor is important, but the cosmetic effect much also very important, because victim breast cancer is almost a woman. We have to consider with the woman's psychology. Recently we do also, this is a relatively big tumor. But in this case, we treated the patient with a neoadjuvant chemotherapy. That means before surgery, in this size breast cancer, we cannot do a breast conserving surgery because it's almost or the breast involved with cancer, breast cancer. So this is actually lymph node. So before surgery, we treat the patient with a chemotherapy. Usually the 6 cycles, every 3 weeks, we treat the patient with a chemotherapeutic agent, and then, for example, this is where 3 times chemotherapy we after. I mean every 3 weeks, 3 times, that means 9 weeks later becomes like this. Much good effect. It's almost disappeared the breast cancer shadow, but 3 times more. I mean every 3 times, every 3 weeks, treat the patient is then, I mean 9 weeks later, then almost disappear. Then we can confirm the nidus here and remove the around the nidus, and then confirm the periphery, and then the breast shape will be conserved. So this patient quality of life is much improved. It's a kind of a miracle treatment effect. Sometimes diffuse multifocal, multicentric breast cancer, then according to textbook, simple total mastectomy, the textbook recommend. But I thought, well, if the nipple and the skin is normal, then totally remove the breast tissue with this incision. So I mean the inframammary incision or the bridge line incision. And this is actually totally remove the breast and then insert implant. So like this. So it's very, very good shape. It's a bridge, okay. So recently I do also like this. This is a both side multicentric breast cancer, multicentric. So he visited me, and I told her, "You are both side breast cancer." At that time, she is surprised at the result. She wanted to make a commit suicide, but I told her, "Don't worry, I'll make you almost the same breast, but no, you cannot breastfeeding." So I persuade this patient and this patient husband, they accepted. So I did like this operation, both sides breast total tissue removed, and then like this, it's out figure is almost same as normal. So like this. In the past, I cannot imagine like this surgical technique. So anyway, like this, many foreign country patients, not only in Asia, Europe, or your country also, visit me, and they were treated by me. It's, I think, more than 250 patients underwent the breast surgery by me. And sometimes, if implant is, they feel there's some cold or foreign body sensation, somebody is there with a low abdominal region, including muscle and fat. With this, like in technique, their own tissue transfer from the lower abdomen to the breast. And this technique is especially the trend. It's a small vessel. Actually, this slide shows relatively bigger diameter, but actually we can this surgery with a microscope like this. It's a small vessel. It's a suture than the anastomosis. So anyway, recently. For breast cancer patients, not only remove the breast cancer treatment, but also we are considering the reconstruction breasts. After the reconstruction breasts, actually almost 90% is they satisfied, but few percent is dissatisfied. But anyway, much improved quality of life after surgery. So that means oncoplastic surgery is not only the only breast surgeon, but also only plastic surgery. We have to cooperation is necessary. Breast surgeon should be aware of plastic surgical technique, and also the plastic surgeon should know the cancer protocol. Breast surgeon and plastic surgeon cooperation for oncoplastic surgery is necessary. My technique is make a PR, so many newsroom, and this one also newsroom, this IT Times, and this IT Times is in English. We Korean we have a Korean character, but to make a PR, we need the English in general necessary, like this. So I visited many countries. They invite me. So many countries, Italy and Hong Kong and Mongolia and Japan and America. And this is Stanford. This is Taipei. And this is Russia. Your country, Arabic. The UAE is they visited me, and the Kazakhstan and China, and also Vietnam and Mongolia and Hungary. I gave a lecture and I did demonstrate surgical technique. So I was invited several times to make a keynote lecture also. So when I visited your country, I gave a lecture about how to treat the breast cancer. Already I told you like this, that your Minister of the Health and Welfare and the Vice Minister of the Health and Welfare, we all together make a ceremony, and the National Insurance Abu Dhabi Daman, the representative CEO, make some contraction between Daman and Ewha Womens Cancer Center Hospital. So with this, there was many breast cancer patients from your country visit me, and I think almost all they are satisfied. Continuously visiting now. This year, the actually COVID-19 makes prevent to visit my hospital, but perhaps next year, many the patients and already the undergone the patient recheck their condition. This is Korean like soccer, like this. Okay, shukran. Thank you. Thank you. Bye bye.